Today in the osteology series, we'll be looking at the scapula or the shoulder blade. The scapula is a bone of the upper limb and it is large, flattened and triangular bone. So it's triangular in shape and flattened and also large. In terms of location, it is located in the upper limb, in the upper part of the posterolateral aspect of the thorax against the 2nd to the 7th ribs. So it is located on the posterior aspect of the thorax. In the posterior aspect of the thorax, it is in the same line against the 2nd to the 7th ribs. Then it is highly mobile and consists of 4 parts. The parts of the scapula include the body. Then we have the 3 processes. We have the spinous process, acromion process, and the coracoid process. So the body is triangular, thin, and transparent. Triangular, thin, and transparent. Then it has the following features. The surfaces, we have the costal and the dorsal surface. The borders, we have the superior, lateral, and medial borders, and also the 3 angles that include the inferior, superior, and lateral angles. The processes, we have the 3 processes: the coracoid process, the spinous process, and the acromion process. Now here is a diagrammatic representation of the scapular bone. So we have the borders. This is the lateral border of the scapula. This is the lateral border. Then this is the medial border. Then here we have the superior border. In terms of the angles, we have the inferior angles. We have the superior angle, and then at this point we should have the lateral angle. So this is a posterior view of the scapula, and here we have the infraspinous fossa. Then this is the spine of the scapula. Now the spine of the scapula divides the scapula into 2 major parts. We have the supraspinous fossa, then we have the infraspinous fossa. The infraspinous fossa provides the place for attachment of the infraspinatus muscle. The supraspinous fossa provides the place for attachment of the supraspinatus muscle. Then you have here the suprascapular notch. We have the suprascapular notch, then the coracoid process, as I have said. So the processes, I have said that we have 3 processes. One of them is the coracoid process. Then we have the acromion process. Then here is the greater scapular notch at this point. Then here we have the glenoid cavity. At this point where we have the glenoid cavity, this is whereby we have the lateral angle of the scapula. So in terms of borders, we have 3 borders: lateral border, we have the medial border, then the superior border. In terms of angles, we have the superior angle, we have the inferior angle, and also the lateral angle at this point. Then in terms of the processes, we have this diagram shows the coracoid process and the acromion process. So to determine the position of the scapula anatomically and its side, the scapula should be holded in such a way that the glenoid cavity faces laterally. Lateral, that means it should be holded in a way such that the glenoid cavity will face sideways, forwards, and slightly upwards, so at an angle of 45 degrees from the coronal plane. Then the coracoid process is directed forwards, and then the sheaf-like spinous process is directed posteriorly. So after doing all this, you'll be able to determine the anatomical position in the side of the scapula, whether it is the right scapula or the left scapula, whether you are looking at the front view or the posterior view of the scapula. So the features and attachments include, we have the surfaces, we have the borders, angles. So those are the features of the scapula. So in terms of the surfaces, we have number one, the costal surface or the subscapular surface. Now this is concave and it is directed medially and forwards. Then it presents three longitudinal ridges. Now these ridges provides attachment to the tendons of the subscapularis muscles. So the name of the surface is the subscapular surface. So it provides attachment to the tendons of the subscapularis muscle. The muscles attached to this surface, we have the subscapularis muscle, the serratus anterior muscle. Subscapularis muscle is one of the muscles of the rotator cuff. So here is a diagram representing, here we have the subscapular fossa. So this is the point where the subscapularis muscle attaches, where the tendons attaches at the ridges of the subscapular fossa, at the subscapular border. So here is the inferior angle of the scapula. We have the lateral border, the medial border, and superior border. Here is the superior angle. Then articular surface for the clavicle. This is where the clavicle attaches. We have the acromion process, coracoid process. Then here is the glenoid cavity, whereby the head of the humerus attaches. Then we have infraglenoid tubercle. Then another surface is the dorsal surface. This is convex, unlike the other surface which was concave. This is convex and it presents a shelf-like projection, that is the spinous process. Then the spinoglenoid notch lies between the lateral border of the spinous process and the dorsal surface of the neck of the scapula. Muscle attachments include the supraspinatus muscles, the infraspinatus muscle, teres minor, teres major, and the latissimus dorsi. So the first three muscles form what we call the rotator cuff muscles, the supraspinatus, infraspinatus, and the teres minor. If we add with the other muscle that we saw on the subscapular surface, that is the subscapularis muscle, then we have the four rotator cuff muscles: supraspinatus, infraspinatus, teres minor, and the subscapularis. They form what we call the rotator cuff muscles. Then at the dorsal surface, we have the three rotator cuff muscles plus the teres major and the latissimus dorsi muscle. Then the superior border, this is the shortest border and it extends between the superior and lateral angles of the scapula. Then we have the suprascapular notch on this border near the root of the coracoid process. Now this notch is converted into the suprascapular foramen by superior transverse ligament. This is one of the ligaments that provides support to the scapular bone. The muscle attachment, we have the superior belly of the omohyoid muscle. Then on the lateral border, this is the thickest border and extends from the inferior angle to the glenoid cavity. The glenoid cavity, this is whereby the head of the humerus inserts or attaches to form the glenohumeral joint, what is commonly known as the shoulder joint. The infraglenoid tubercle is present at its upper end just below the glenoid cavity. Then the long head of the triceps muscles arises from the infraglenoid tubercle. So the triceps muscle is a muscle that's found posteriorly to the humerus muscle. It is one of the muscles of the arm. Now, I've said that the lateral border is the thickest border. Now, the reason why it is thick is because it acts as a fulcrum during rotation of the scapula. Acting as a fulcrum during the rotation of the scapula. So here we have the spinous process. We have the acromion process, the superior angle supraglenoid tubercle. Then we have the coracoid process. So the three processes, spinous, acromion, and the coracoid process. Then we have the glenoid cavity, then the infraglenoid tubercle. Infra means below, supra means above. So we have the supraglenoid tubercle above the glenoid cavity, then infraglenoid tubercle below the glenoid cavity. Then the medial border or the vertebral border, it extends from superior angle to the inferior angle. It is thin and angled at the root of the spine of the scapula. The muscles that are attached at this point, we have the serratus anterior, levator scapulae, and the two rhomboids, that's rhomboid major and minor. Then the angles, we have three. The scapular bone has three angles. The inferior angle, this lies over the seventh rib or the seventh intercostal space. So while we were looking at the anatomical position of the scapula, we say that it is located posterior to the thorax and between the second rib and the seventh rib. So the inferior angle, this is the inferiormost part of the scapula, and it lies over the seventh rib or the seventh intercostal space. And the superior angle is at the junction of the superior and medial borders and lies over the second rib. So this explains the reason why we said that the scapular bone lies between the second and the seventh rib. Superior angle at the second rib, then the inferior angle at the seventh rib. Then the lateral angle, this is whereby we find the head of the scapula. It is truncated and bears the glenoid cavity. I've said that the glenoid cavity, this is whereby the head of humerus attaches to form the glenohumeral joint or the shoulder joint. Then the spinous process or the spine of the scapula. These are triangular shelf-like bony projection that is attached to the dorsal surface of the scapula. So it divides the scapula into two parts. The upper, which is the supraspinous fossa, which provides attachment for the supraspinatus muscle, and then the lower end, the lower infraspinous fossa, which provides surface for the attachment of the infraspinatus muscle. So the spinous process or the spine of the scapula, it is a projection that divides the scapula into two parts, the upper supraspinous fossa and the lower infraspinous fossa. Supra means above, so it is supraspinous, above the spine of the scapula. Infra means below, so below the spine of the scapula. Then the processes, we have another process, we have the acromion process or the acromion. This is a projection, it projects forwards almost at the right angle from the lateral end of the spine and overhangs the glenoid cavity. It has a tip, two borders, and two surfaces. The superior surface is subcutaneous and rough. Subcutaneous means it can be palpated and can be felt. This is the part of the scapula that you can palpate and feel, and it's usually rough. Then the inferior surface is smooth and related to the subacromial fossa. Then the coracoid process. This arises from the upper part of the head of the scapula and bends sharply so as to project forwards and slightly lateral. The muscles that attach to the coracoid process include the short head of the biceps brachii, coracobrachialis, then the pectoralis minor. The ligament attachments, we have the coracoacromial ligaments, coracoclavicular ligaments, then the coracohumeral ligaments. So coracoacromial, this means that it arises from the coracoid process to the acromial process. Coracoclavicular arises from the coracoid process to the clavicle. Then the coracohumeral, it arises from the coracoid process to the humerus. That's where we get the names. Basically, the functions of these ligaments are to enforce the work of the muscles in providing additional strength, stability, provide additional stability to the shoulder joint. So here is a diagrammatic representation. We have the coracoid process, the acromion process, then we have the spinous process. In terms of the borders, we have the superior border, lateral border, and the medial border. In terms of the angles, here we have the inferior angle, superior angle, and then the lateral angle. The lateral angle, I said, is where we have the glenoid cavity. The glenoid cavity provides a surface for the attachment of the head of the scapula of the humerus bone to form the glenohumeral joint. Then here we have the infraglenoid tubercle. That means it is just below the glenoid cavity. Then we have the supraglenoid, that is above. Here we have the suprascapular notch. Then we have the oblique ridges for the attachment of the tendons of the subscapularis muscle. Then let's look at the ossification. The scapula ossifies in the cartilage. Its ossification is cartilaginous in nature. This in contrast to the clavicle bone, which ossifies in membranocartilaginous. So its ossification, the ossification of the scapula is cartilaginous. Then it has 8 ossification centers. 1 is primary, then the other 7 are secondary centers. Now the secondary centers will appear as follows. We have 2 centers in the coracoid process, 2 in the acromion process, then 1 at the medial border, 1 at the inferior angle, and 1 at the lower part of the rim of the glenoid cavity. So those are the ossification centers of the scapula. 1 primary, then 7 are secondary. So here is a diagram to sum it up. We have the medial border, lateral border, then the superior border. Here is the infraspinous fossa. This is whereby the infraspinatus muscle attaches. We have the infraglenoid tubercle, then the subscapular nerve, spinoglenoid notch, lateral border of the acromion. We have the acromion process, spinous process, then we have the facet for the acromioclavicular joint.